201. A nurse is caring for a patient receiving a platelet transfusion. Which vital sign change indicates a reaction? A. Temperature increased to 101 degrees Fahrenheit. B. Heart rate of 70 bpm. C. Blood pressure of 120/80 mmHg. D. Respiratory rate of 16 breaths/min. Answer. A. Temperature increased to 101 degrees Fahrenheit. Rationale. A temperature increased to 101 degrees Fahrenheit. A. Suggests a febrile non-hemolytic reaction during a platelet transfusion, requiring intervention. Heart rate, B. Blood pressure, C. And respiratory rate, D. Are normal and not indicative of a reaction. 202. A patient with iron deficiency anemia is prescribed ferrous sulfate. What should the nurse teach about storage? A. Store in a cool, dry place. B. Keep in a refrigerator. C. Store with food. D. Keep in a humid environment. Answer. A. Store in a cool, dry place. Rationale. Ferrous sulfate should be stored in a cool, dry place. A. To maintain stability. Refrigeration, B. Is unnecessary. Storing with food, C. Risks contamination. Humidity, D. May degrade the medication. 203. A nurse is caring for a patient with a history of pulmonary embolism. Which diagnostic test monitors treatment? A. D-dimer. B. INR. C. Hemoglobin. D. Platelet count. Answer. B. INR. Rationale. INR, B. Monitors warfarin therapy, commonly used for pulmonary embolism. D-dimer, A. Diagnoses clots but not treatment. Hemoglobin, C. And platelet count, D. Are not specific to anticoagulant therapy. 204. A patient with sickle cell anemia reports abdominal distension. What is the nurse's first action? A. Assess bowel sounds. B. Encourage ambulation. C. Apply a warm compress. D. Restrict fluid intake. Answer. A. Assess bowel sounds. Rationale. Abdominal distension in sickle cell anemia may indicate vaso-occlusion or organ complications, so assessing bowel sounds, A. Evaluates gastrointestinal function. Ambulation, B. May be unsafe. Warm compresses, C. Are ineffective. Fluid restriction, D. Is inappropriate. 205. A nurse is teaching a patient with folate deficiency anemia. Which dietary change is most effective? A. Increase leafy green vegetables. B. Increase dairy products. C. Increase refined grains. D. Increase bananas. Answer. A. Increase leafy green vegetables. Rationale. Leafy green vegetables, A. Are high in folate, essential for folate deficiency anemia. Dairy, B. Refined grains, C. And bananas, D. Are low in folate and less effective. 206. A patient with chronic lymphocytic leukemia reports night sweats. What should the nurse document these as? A. B. Symptoms. B. Allergic reactions. C. Infection signs. D. Metabolic imbalances. Answer. A. B. Symptoms. Rationale. Night sweats in chronic lymphocytic leukemia are B. symptoms. A. Indicating systemic disease. They are not allergic reactions. B. Infection signs. C. Or metabolic imbalances. D. 207. A nurse is caring for a patient with a platelet count of 20,000/mm superscript 3. Which activity should the patient avoid? A. Using a soft toothbrush. B. Shaving with a straight razor. C. Eating a balanced diet. D. Assisted ambulation. Answer. B. Shaving with a straight razor. Rationale. A platelet count of 20,000/mm superscript 3 indicates severe thrombocytopenia, so shaving with a straight razor. B. Risks bleeding. A soft toothbrush, A. Balanced diet, C. And assisted ambulation, D. Are safe. 208. A patient with pernicious anemia reports paresthesia. What is the nurse's best action? A. Administer vitamin B12. B. Encourage ambulation. C. Apply warm compresses. D. Restrict dietary folate. Answer. A. Administer vitamin B12. Rationale. Paresthesia in pernicious anemia is due to vitamin B12 deficiency affecting nerves, so administering vitamin B12 A is the best action. Ambulation B does not treat neuropathy. Warm compresses C are ineffective. Folate restriction D is unnecessary. 209. A nurse is monitoring a patient receiving warfarin. Which interaction should the nurse teach the patient to avoid? A. Grapefruit juice. B. Orange juice. C. Milk. D. Bananas. Answer. A. Grapefruit juice. Rationale. Grapefruit juice A can interfere with warfarin metabolism, affecting INR levels. Orange juice B, milk C, and bananas D do not significantly interact with warfarin. 210. A patient with sickle cell disease is admitted with a fever. What is the nurse's first action? A. Administer antipyretics. B. Obtain blood cultures. C. Restrict oral fluids. D. Apply a cooling blanket. Answer. B. Obtain blood cultures. Rationale. Fever in sickle cell disease suggests infection, so obtaining blood cultures B. identifies the cause and guides treatment. Antipyretics A and cooling blankets D treat symptoms. Fluid restriction C is inappropriate. 211. A nurse is caring for a patient with a history of hemophilia. Which lab result indicates effective treatment? A. Normal factor VIII levels. B. Increased platelet count. C. Normal hemoglobin. D. Decreased INR. Answer. A. Normal factor VIII levels. Rationale. Hemophilia A treatment aims to normalize factor VIII levels A. Platelet count B, hemoglobin C, and INR D are not specific to hemophilia treatment. 212. A patient with multiple myeloma is at risk for which condition? A. Hypercalcemia. B. Hypoglycemia. C. Hyponatremia. D. Hypokalemia. Answer. A. Hypercalcemia. Rationale. Multiple myeloma causes bone destruction, leading to hypercalcemia A. Hypoglycemia B. Hyponatremia C. and hypokalemia D are not primary complications. 213. A nurse is caring for a patient receiving a blood transfusion. Which symptom indicates an allergic reaction? A. Itching. B. Fever. C. Dyspnea. D. Chills. Answer. A. Itching. Rationale. Itching A is a sign of an allergic transfusion reaction, often with hives. Fever B and chills D suggest a febrile reaction. Dyspnea C may indicate fluid overload or hemolysis. 214. A patient with iron deficiency anemia reports leg cramps. What should the nurse assess first? A. Electrolyte levels. B. Blood glucose. C. Skin turgor. D. Joint mobility. Answer. A. Electrolyte levels. Rationale. Leg cramps and iron deficiency anemia may indicate electrolyte imbalances, A. from dietary deficiencies or treatment side effects. Blood glucose, B. Skin turgor, C. and joint mobility, D. are not directly related to leg cramps. 215. A nurse is caring for a patient with a history of pulmonary embolism. Which instruction promotes safety? A. Wear compression stockings. B. Restrict physical activity. C. Increase dietary sodium. D. Apply heat to the chest. Answer. A. Wear compression stockings. Rationale. Compression stockings A. promote venous return, reducing clot risk in pulmonary embolism. Restricting activity B. is unnecessary long-term. Sodium intake C. is unrelated. Heat D. is not indicated. 216. A patient with sickle cell anemia reports chest tightness. What is the nurse's first action? A. Assess lung sounds. B. Encourage ambulation. C. Apply a warm compress. D. Restrict fluid intake. Answer. A. Assess lung sounds. Rationale. Chest tightness in sickle cell anemia may indicate acute chest syndrome, so assessing lung sounds A. is the priority. Ambulation B. may worsen symptoms. Warm compresses, C, are ineffective. Fluid restriction, D, is inappropriate. 217. A nurse is teaching a patient with hemophilia about activity safety. Which activity is safe? A. Swimming. B. Football. C. Weightlifting. D. Boxing. Answer: A. Swimming. Rationale: swimming, A, is a low-impact activity safe for hemophilia patients. Football, B, weightlifting, C, and boxing, D, are high risk for trauma and bleeding. 218. A patient with chronic lymphocytic leukemia reports bruising. What is the nurse's first action? A. Assess platelet count. B. Encourage ambulation. C. Apply a warm compress. D. Restrict fluid intake. Answer: A. Assess platelet count. Rationale: bruising in chronic lymphocytic leukemia may indicate thrombocytopenia, so assessing platelet count, A, is the priority. Ambulation, B, risks injury. Warm compresses, C, worsen bruising. Fluid restriction, D, is irrelevant. 219. A nurse is caring for a patient with a platelet count of 30,000/mm superscript 3. Which medication should be avoided? A. Aspirin. B. Acetaminophen. C. Vitamin C. D. Calcium supplements. Answer: A. Aspirin. Rationale: aspirin, A, inhibits platelet function, increasing bleeding risk in thrombocytopenia. Acetaminophen, B, vitamin C, C, and calcium, D, do not affect bleeding risk. 220. A patient with pernicious anemia reports difficulty swallowing. What should the nurse suspect? A. Glossitis. B. Esophageal stricture. C. Gastritis. D. Dehydration. Answer: A. Glossitis. Rationale: difficulty swallowing in pernicious anemia is often due to glossitis. A. Inflammation of the tongue from vitamin B12 deficiency. Esophageal stricture, B, gastritis, C, and dehydration, D, are less likely without specific symptoms. 221. A nurse is monitoring a patient receiving fresh frozen plasma. Which lab result indicates effective treatment? A. Normal prothrombin time. B. Increased hemoglobin. C. Normal platelet count. D. Decreased white blood cell count. Answer: A. Normal prothrombin time. Rationale: fresh frozen plasma corrects coagulopathy, so a normal prothrombin time, A, indicates effective treatment. Hemoglobin, B, platelet count, C, and white blood cell count, D, are not directly affected by plasma. 222. A patient with polycythemia vera reports itching after bathing. What should the nurse suspect? A. Aquagenic pruritus. B. Allergic reaction. C. Infection. D. Dehydration. Answer: A. Aquagenic pruritus. Rationale: itching after bathing in polycythemia vera is aquagenic pruritus, A, a common symptom due to histamine release. Allergic reaction, B, infection, C, and dehydration, D, are less likely without specific symptoms. 223. A nurse is caring for a patient with a history of deep vein thrombosis. Which lab test monitors for recurrence? A. D-dimer.
B. Hemoglobin.
C. Platelet count. D. Blood glucose. Answer: A. D-dimer. Rationale: elevated D-dimer, A, indicates clot formation, useful for detecting DVT recurrence. Hemoglobin, B, platelet count, C, and blood glucose, D, are not specific to DVT recurrence. 224. A patient with iron deficiency anemia reports hair loss. What should the nurse explain? A. This is a common symptom of anemia. B. This indicates an allergic reaction. C. This is a sign of infection. D. This requires immediate discontinuation of iron. Answer: A. This is a common symptom of anemia. Rationale: hair loss, A, can occur in iron deficiency anemia due to reduced oxygen delivery to hair follicles. Allergic reaction, B, and infection, C, are unrelated. Discontinuation, D, is unnecessary without other symptoms. 225. A nurse is caring for a patient with a history of pulmonary embolism. Which symptom indicates a recurrence? A. Dyspnea. B. Mild fatigue. C. Dry skin. D. Increased appetite. Answer: A. Dyspnea. Rationale: dyspnea A is a hallmark of pulmonary embolism recurrence, indicating compromised lung perfusion. Fatigue B, dry skin C, and increased appetite D are not specific to recurrence. 226. A patient with sickle cell anemia is prescribed folic acid. What is the purpose of this supplement? A. Enhance red blood cell production. B. Reduce pain. C. Prevent infection. D. Increase platelet production. Answer: A. Enhance red blood cell production. Rationale: folic acid A supports red blood cell production in sickle cell anemia, where rapid cell turnover occurs. It does not reduce pain B, prevent infection C, or increase platelets D. 227. A nurse is teaching a patient with hemophilia about self-care. Which instruction is most important? A. Wear a medical alert bracelet. B. Increase dietary sodium. C. Avoid low-impact exercise. D. Restrict fluid intake. Answer: A. Wear a medical alert bracelet. Rationale: a medical alert bracelet A ensures prompt treatment for bleeding and hemophilia during emergencies. Sodium intake B and fluid restriction D are unrelated. Low-impacted exercise C is safe. 228. A patient with chronic lymphocytic leukemia reports weight loss. What should the nurse assess next? A. Presence of fever. B. Blood glucose levels. C. Joint range of motion. D. Skin hydration. Answer: A. Presence of fever. Rationale: weight loss in chronic lymphocytic leukemia may be a B symptom, often accompanied by fever A, indicating disease progression. Blood glucose B, joint range C, and skin hydration D are not directly related. 229. A nurse is caring for a patient with a platelet count of 15,000/mm superscript 3. Which symptom indicates a medical emergency? A. Intracranial bleeding. B. Mild fatigue. C. Dry skin. D. Increased appetite. Answer: A. Intracranial bleeding. Rationale: intracranial bleeding A in severe thrombocytopenia 15,000/mm superscript 3 is a medical emergency requiring immediate intervention. Fatigue B, dry skin C, and increased appetite D are not urgent. 230. A patient with pernicious anemia is prescribed vitamin B12. What should the nurse monitor? A. Neurological symptoms. B. Blood glucose. C. Respiratory rate. D. Skin turgor. Answer: A. Neurological symptoms. Rationale: vitamin B12 deficiency in pernicious anemia can cause neurological symptoms, e.g., paresthesia. So monitoring these A. assesses treatment response. Blood glucose B, respiratory rate C, and skin turgor D are not primary concerns. 231. A nurse is monitoring a patient receiving warfarin. Which lab result indicates a need for intervention? A. INR of 4.0. B. INR of 2.5. C. Platelet count of 200,000/mm superscript 3. D. Hemoglobin of 12G/DL. Answer: A. INR of 4.0. Rationale: an INR of 4.0 A is above the therapeutic range 2.0 to 3.0, indicating a bleeding risk requiring intervention. INR of 2.5 B is therapeutic. Platelet count C and hemoglobin D are normal. 232. A patient with sickle cell disease reports leg swelling. What is the nurse's first action? A. Elevate the leg. B. Apply a warm compress. C. Encourage ambulation. D. Restrict fluid intake. Answer: A. Elevate the leg. Rationale: leg swelling in sickle cell disease may indicate vaso-occlusion or thrombosis, so elevating the leg A. reduces swelling. Warm compresses B. may worsen swelling. Ambulation C. risks complications. Fluid restriction, D, is inappropriate. 233. A nurse is teaching a patient with folate deficiency anemia. Which food is most beneficial? A. Fortified cereals. B. White rice. C. Milk. D. Apples. Answer. A. Fortified cereals. Rationale. Fortified cereals, A, are high in folate, beneficial for folate deficiency anemia. White rice, B, milk, C, and apples, D, are low in folate. 234. A patient with multiple myeloma reports bone pain. What is the nurse's best action? A. Administer prescribed analgesics. B. Encourage weight-bearing exercises. C. Apply ice to affected areas. D. Restrict calcium supplements. Answer. A. Administer prescribed analgesics. Rationale. Bone pain in multiple myeloma is due to lytic lesions, requiring analgesics, A, for relief. Weight-bearing exercises, B, may increase fracture risk. Ice, C, is less effective. Calcium supplements, D, may be needed for hypercalcemia. 235. A nurse is caring for a patient receiving a blood transfusion. Which lab result indicates a transfusion reaction? A. Elevated lactate dehydrogenase. B. Normal hemoglobin. C. Normal platelet count. D. Decreased white blood cell count. Answer. A. Elevated lactate dehydrogenase. Rationale. Elevated lactate dehydrogenase, A, indicates hemolysis, a sign of a transfusion reaction. Normal hemoglobin, B, platelet count, C, and decreased white blood cell count, D, are not specific to transfusion reactions. 236. A patient with iron deficiency anemia reports brittle nails. What should the nurse explain? A. This is a common symptom of anemia. B. This indicates an allergic reaction. C. This is a sign of infection. D. This requires immediate discontinuation of iron. Answer. A. This is a common symptom of anemia. Rationale. Brittle nails, A, are a common symptom of iron deficiency anemia due to reduced oxygen delivery. Allergic reaction, B, and infection, C, are unrelated. Discontinuation, D, is unnecessary. 237. A nurse is caring for a patient with a history of pulmonary embolism. Which medication is most likely prescribed long-term? A. Warfarin. B. Aspirin. C. Clopidogrel. D. Iron supplements. Answer. A. Warfarin. Rationale. Warfarin, A, is commonly prescribed long-term for pulmonary embolism to prevent recurrence. Aspirin, B, and clopidogrel, C, are antiplatelet agents, not primary for embolism. Iron supplements, D, are unrelated. 238. A patient with sickle cell anemia reports fatigue. What is the nurse's first action? A. Assess hemoglobin level. B. Encourage vigorous exercise. C. Restrict fluid intake. D. Apply a warm compress. Answer. A. Assess hemoglobin level. Rationale. Fatigue in sickle cell anemia is likely due to anemia, so assessing hemoglobin level, A, is the first step. Vigorous exercise, B, is unsafe. Fluid restriction, C, is inappropriate. Warm compresses, D, are irrelevant. 239. A nurse is teaching a patient with hemophilia about bleeding management. Which instruction is most important? A. Apply firm pressure to bleeding sites. B. Increase dietary sodium. C. Avoid low-impact exercise. D. Restrict fluid intake. Answer. A. Apply firm pressure to bleeding sites. Rationale. Applying firm pressure, A, controls bleeding in hemophilia, a critical self-care measure. Sodium intake, B, and fluid restriction, D, are unrelated. Low-impact exercise, C, is safe. 240. A patient with chronic lymphocytic leukemia is prescribed rituximab. What should the nurse monitor during infusion? A. Infusion-related reactions. B. Blood glucose. C. Respiratory rate. D. Skin turgor. Answer. A. Infusion-related reactions. Rationale. Rituximab can cause infusion-related reactions, e.g., fever, chills, so monitoring these, A, is critical. Blood glucose, B, respiratory rate, C, and skin turgor, D, are not primary concerns.